Okay, hello everybody. We are here and we are starting another day and another session, and this is our general testing time. So, welcome to the event. And let me check everywhere. Time, not much. For some reason, I seem to be hearing this double. I hope everyone else is hearing it fine. Anyone has already joined? Please let me know. Oh, Dr. Osmani, hi. Dr. Nasser, hello, welcome. With this new system, I cannot type there, so I'll just say hello to you all. Well, it has its good points and it has its bad points. This is one of the bad points, that I can't really type there directly. So, but I can see your messages, so if you let me know everything is good, that will be nice. I have checked, it all seems good, but anyway. We shall be all set to go soon. You are most welcome, Dr. Nasser. Always a great pleasure to have you around and to hear your comments at the end. So you heard and you saw the beginning, and that is, yes, the information about the upcoming event, which is now all live and ready for registration. I will share the link with everybody soon enough. So, coming to today's program, it is, of course, a lot of what we do is always about oral cancer. And we are coming back to oral cancer today with some interesting research about the downregulation in PERP proteins with Dr. Balasundri. Now, I have known Dr. Balasundri for some time, actually, since the time we were both teaching. So that was some time back. But of course, she was teaching till just last year, and she the former professor and head oral pathology and microbiology, career dental college and hospital, Lucknow. According to her, her most memorable moment was when she received the Best Paper Award by Professor Pinberg in 1995, which has no doubt further ignited her interest in oral cancer. It is a great pleasure to have you with us today, Dr. Balasundri. Thank you so much for joining us. And so now I shall let her take over. And hi. Yes, you can. Right, you can please share your screen and start with the presentation. Sorry, one
You're
second.
able to hear?
Yes, I can hear you. Okay.
Okay. Thank you so much. Thank you so much for inviting me today. It's been ages since I have actually, spoken out in public like that. It's usually in the classrooms or, yelling at my PG students. But apart from that, nothing. So thank you so much. And yes, today I would like to speak about, a particular type of protein, which is called as PERP. We'll go into the detail later, but this is kind of a neglected protein. But when I went into learning more about it and reading more about it and seeing people doing research on it, it seems to be playing a more important role in tumorigenesis, right from initiation to progression. We have studied so much about E Cadherins, and it was one of the fancy topics, and RPGs year after year have done immense study on E Cadherins. But you'll be surprised to know that even before there is a downregulation of this E cadherins, the PERP protein is downregulated. So I just wanted to share some of my points and views on it. My presentation is not very long, it must be hardly 15-20 minutes. But I just want to share this with you all so that we can take this up more seriously as one of the topic to research, because now it is very important that we get to the root cause of it and try to have some kind of a target gene therapy like we have for breast carcinomas, for cervical carcinomas, and these patients seem to be having a better lifestyle even after the surgery, which is not there as such in oral cancer. So I just want to, feed in this that there is an important protein, and I'm sure, future to come, if this is unraveled, then we may be just looking at possible gene target therapy for oral cancers. Having said that, I'll just, share my screen. Uh, I'm sorry, I'm not a very tech savvy person, but um, is my screen
Yes,
visible?
it's there. It's there. Yes, it's there.
It's there? Okay.
Yes.
So, having said that, this is my topic is the unraveling the role of PERP protein in carcinogenesis. Now, before I go to talk in detail about PERP, let me just briefly go through what are desmosomes. Desmosomes are membrane structures that mediate cell to cell membranes in addition. This complex connects the cytoplasmic intermediate filaments through desmosomal interactions, and they act as a resistant to mechanical stress in tissues. So, as you can see in the picture, I don't have to go into the detail because this is something that all of us already know about what are desmosomes and Over here are the Cadherins, and this is the extracellular space. So this is just a diagrammatic representation of desmosome, and I picked it up from Wikipedia. Now, what is this desmosome actually composed of? You have three subfamilies, protein subfamilies, which are the core components. One is the desmosomal cadherins, the armadillo proteins, and the plankin proteins. The desmosomal cadherins are of two types, desmoglein and desmocolin, whereas the armadillo proteins are of two, placophilins and placoglobin. And the plakin proteins is one, which is desmoplakin. Now, over here, I have put PERP because the exact position of PERP is not yet known, and it is either one of the, or comes under plakin proteins, or it is a separate protein on its own. Now, what does desmosome cadherins do? They are a class of transmembrane proteins, that is DSG and DSC, which mediate cell to cell adhesions and desmosome assembly. But they also help in signaling scaffolds for cell movement. Whereas armadillo proteins, they are they bind to the intercellular fragment of desmosomal cadherins. Whereas plakin proteins, they're connected to intermediate filaments through C domain, and they are most abundant part of the desmosome. Whereas the PERP, it is responsible for desmosomal assembly and its maintenance, but its interactive partners are yet unknown. This group is essential for maintaining the tissue integrity and the architecture. Mandana, just tell me if I'm going too fast. This PERP, which is a P53 apoptosis effector related to PMP22. This is a very small, around 21.4 kilodalton transmembrane polypeptide with an amino acid sequence indicative of a tetraspanin character. It is enriched in plasma membrane and apparently contributes to the cell to cell contacts. It is a P53 P63 regulated gene encoding a desmosome protein that plays a very critical role in cell to cell adhesion and tumor suppression. Now, this particular protein is present in various epithelium, like the epithelium of the skin, in the cardiac muscles, and in mammary glands, in intraocular epitheliums, and even in mineralized tissues. Now, let us just briefly touch through these. PERP in skin cancer. The downregulation of PERP has been studied in mice and skin cancer, and even studied in human carcinomas. Here it is observed that there is a loss of PERP with adherens junction intact. Now, studies were conducted to assess whether this loss of desmosomal component expression reflected a general change in different stages of the cell during tumorigenesis, such as epithelial mesenchymal transition. Most of the cells in the tumors were having robust staining, as it is seen in these pictures of E Cadherin. But there was a loss or downregulation of this particular gene, protein PERP. This PERP loss can facilitate downregulation of direct loss of desmosomes, and they contribute to tumor development. PERP loss and retention of E cadherin represents to a significant phase in the tumor genesis. Now, PERP in breast carcinomas. PERP loss affects mammary epithelium by causing the accumulation of inflammatory cells around mature mammary epithelium. Reduced PERP is associated with many breast carcinomas too. It can be used as a potential prognostic indicator, or even a molecular target in these breast carcinomas, as it is seen in these diagrams. Now, PERP and mineralized tissue. In enamel, it is essential for the cell to cell attachment and gene expression during tooth development. The expression of PERP is controlled by P63, which is a master regulator of stratified squamous epithelial development. During enamel formation, this PERP is localized in the interface between ameloblast and the stratum intermedium. Whenever there is a PERP null epithelium, at that time there are severe enamel defects because of detachment of these ameloblasts from the stratum intermedium. It's the detachment of ameloblasts from the stratum intermedium. And because of this lack of PERP, it causes downregulation of genes required for proper enamel formation. So far we have seen that loss of PERP has affected the skin. It's one of the potential cause for breast carcinomas, and even now we just read about PERP with enamel defects whenever there is a loss of it. It is also seen in various other tissues, which I don't want to go too much into the details, but it is present in cardiomyocytes, in bile canaliculi of the liver. It is seen in urothelial cell layers. It is seen in uveal melanoma, which is supposed to be one of the most common intraocular tumors. It is also expressed in simple columnar complex and transitional epithelium. Now, so much of studies have been done on all the types of epithelium and all the parts. Let us just go briefly with the topic that concerns us, that is PERP and oral cell carcinoma. Now, PERP is important as a tumor suppressor in humans. They demonstrate that desmosome deficient achieved by PERP inactivation can promote carcinomas and suggest the potential utility in monitoring it. The PERP status for staging, prognostication, or the treatment of human cancer. There is a definitive genetic evidence that loss of desmosome component can in fact promote tumorigenesis in vivo. PERP loss may also contribute to tumor progression. PERP deficiency promotes cancer by enhancing its survival, desmosome loss, and inflammatory process. And we already know the role of inflammation in tumorigenesis. So there was an article in Triple O way back in 2014, after which I don't think I have seen any, I've not come across rather any literature which has done any study with PERP on oral squamous cell carcinomas. This protein has been evaluated as a potential prognostic marker in head and neck squamous cell carcinoma, and this study actually they did it on HPV negative patients, and they found that orderly progression from epithelial dysplasia to carcinoma in situ and then invasive carcinoma. PERP loss starting at the basal level may be associated with oral epithelial dysplasias, and PERP loss could be the predictor of worse outcome in HPV negative squamous cell carcinoma. Decreased PERP expression in the invasive tumor may correlate with the more clinical aggressive phenotype of it. So, what they have seen is whenever there is a loss of PERP, they have seen that those tumors have acted or they have behaved more aggressively. So, in this table, they have given in this diagram, they have given the comparison between PERP and E Cadherin. And it is seen that when there is a PERP negative or there is an PERP downregulation, there is a positive E Cadherin. That means the E Cadherins are yet intact, which says that PERP downregulation is a more earlier sign of carcinogenesis than E Cadherin. E Cadherin usually occurs at a later stage. But unfortunately, very little or no research has yet been done on this PERP regulation. In fact, I have not come across any article or any research which is done in India on PERP. So what next? What do we do now? No, or rather, what can we do? Now, just to summarize the whole thing, it is like dysregulated cell to cell adhesion. They play a critical role in epithelial cancer development. Studies of human cancers have been indicated that loss of adhesion molecules or complexes known as adherence junctions, they contribute to tumor progression and thus metastasis. But very little is known regarding the role of cell to cell adhesions, desmosomes during cancer development. This PERP is downregulated with adhesion junctions which may remain intact. So, what do? We need to do a further research of PERP downregulation in oral squamous cell carcinoma so that we can enhance the diagnosis, the grading, and prognostication, leading to more informed choices of therapy. So, are we looking at a eureka moment out here? Mm. Are we, very close to finding out the target gene which would help us in treating this carcinomas at a very early stage more effectively, and not that the patient needs to go in for a mandibulectomy? So it is what I want to highlight in this article. I know that I haven't you know gone into the details of E Cadherins and the other types of desmosomal proteins because extensively studies have been done on this, and the concentration span for any person listening to any talk is not more than 20 minutes. So I thought I'll keep my talks you know more concise and more particular to this particular protein gene, which has not yet been discussed openly a lot. So, I feel that my eureka moment would be that if we study this gene in detail, maybe we are actually staring at a possible gene target therapy. Thank you so much for your patient hearing. Any questions, please?
Thank you. Yes, that was indeed very nice and short and kept totally to the time. And now I'm going to request everyone to please come up with their questions, comments, and of course, if you like the presentation, hit like too. That would be nice. In the meanwhile, let me see. So far, nothing. Let's just wait and see. Let's come back to our own image. Right. You got to, okay, I will hide it. Yes, done.
Okay, I'm done.
So, yes, it takes a few seconds. There's a lag
No
between what
problem.
is happening here and what's happening there. So,
Oh, okay.
yeah, so we will have a little while before the questions come in.
Sure.
If you had
So,
the opportunity to answer one question, what would be
yeah,
the question you would love to answer right now?
I'm open to all.
Now,
So,
anything you yourself
see,
want to add that
see,
did
the
not
thing is,
fit in there?
no, see, basically, what happened is this. I would just like to tell you a brief history behind this presentation of mine. Honestly speaking, I had taken up this topic as my PhD topic, but due to some personal, reasons, I was just not able to carry on with it. But I really took this up very, very passionately, and I did have a lot of talk with other teachers and all, and then I did go forward with it. And when I started studying this, that is when I really thought that it is high time that we don't go with the popular topics. It's a request to all the postgraduate students, the PhD scholars, and the very great minds of researchers out there. Okay, let us do something in the field of oral cancer that we can possibly touch at a proper treatment, because personally also I have a few family members who have gone through this, and I had somebody very close to me gone through breast carcinomas, and I see her life. She is leading a much better life than another family member of mine who had an oral carcinoma. and then had to go in for a hemimandibulectomy and then for a total mandibulectomy. And it was, and even now, it's not very, what to say, the standard or the way of living is not always very good. So I was just thinking, why not? We have done so much research on breast carcinomas. There's so much on cervical carcinomas and very little on oral cancers as such. I know we have done, like, I myself, our PhD, our MDS topic was on oral carcinomas. Like mine was on SCM studies. What happens over here is we have a phase, and that is what I've observed among the PG students also. They pick up on topic and then, consecutively 3 4 batches they do on the same. So we had Agnor, then we had E Cadherins, some. But what are we actually achieving? I think it's high time all of us actually start thinking. There are a lot of obstacles because it's research is usually in the colleges, and not all colleges want it this way. It's more for PGs. So, but yes, people who are very passionate, just one um, identification of one gene could help
True.
mankind, and it could be you doing it. So it's a request that, all the PGs and all these scholars,
Yes.
the researchers, think in these lines of doing something, a
Yes.
milestone in
So, Dr.
cancer.
Balasundri,
So
we have one
yes,
question.
yeah.
Professor Joss is asking, is there a commercial antibody available?
There is a commercial antibody available. I'm not getting the name, but yes, there is. Actually, you can do your quantitative RT-PCR, go in for an immunofluorescent. I mean, that was how I had planned my study too. And there is a commercial antibody. Yes, it is available. So if we can start in small batches, it will be nice. And it is an excellent, trust me, it's an excellent research topic.
We
After
have one.
2014, I have hardly seen any articles on it.
Interesting. That's a long time. Right.
Yeah,
So we have Dr. Nasser from the US saying, superb review, and you nicely emphasized HPV negative cancers. Any comment on P53 EXP? What is that?
I'm sorry,
Apoptosis
sir.
and expression. Expression must be. Expression, apoptosis, and expression of PRP in HPV negative and positive cancer differences.
Um, yeah, it is said that in, I mean, whatever I have read, I haven't done any research on it, but what I've read in this article, it was published in 2014 in Triple O. I think one of the author is Veronica. She had done even studies on mice for skin carcinomas. What they have written over there is HPV negative. The loss of PERP is more evident and it is more locally aggressive. So it is like if there is a downregulation of PERP with HPV negative, suppose it is more of prognostic value, or the prognosis is not very good and there is a relapse, and it's a locally aggressive tumor. I didn't get come across anything where they have um, kind of compared the HPV negative and HPV positive. If there is something, I would love to listen because I'm open to suggestions and something that will increase my knowledge on it. Sir, I would love to listen if there is something.
All right. So we also have one from Dr. Abhishek Tiwari. Great presentation, ma'am. If there is loss or downregulation of this PERP protein earlier than E Cadherins, then there must be a picture of role of this protein in tumor initiation rather than progress.
Yes, it is definitely on tumor initiation too. So that is what it does. There is a downregulation of this PERP protein even before the loss of E cadherins. So it is present in initiation, then in progression, and so on. But yes, it is definitely there in initiation. That is why I was kind of emphasizing that we really need to look into deeper into this protein, which is not known. It's there is no documented proof or anything of that kind. It has been experimentally seen in mice, but yes, there is definitely a role of it in initiation.
That is true. So we also have a lot, no more questions, and we have a lot more of everyone saying thank you. And this one is from Dr. Meheranges from Fiji. For some reason, the names of those who are logged in from Facebook is not coming here, but this is from her. She is also one of our regulars. Thank you, Dr. Meher. And oh, we have Vinay Hazarasa with us. Good morning, sir.
Oh, now I'm nervous.
It feels like exam, doesn't it?
Yeah.
That happens sometimes. I know. It feels like that. And one of our seniors is sitting there and,
And he's my sir. So,
okay. Right. So otherwise, it has always been like you were saying, the thing with oral cancer, what I think, I don't know, everyone else can weigh in on it. From what I have found is that oral cancer has this interesting thing that it takes a long time to actually start. The steps of the initiation, the beginning takes a long time, but the minute it does start, then it is one of the most aggressive tumors, and it really goes through very, very fast. It can go from its early stage to an advanced stage within just a year, and which is one of the reasons that I think the survival for oral cancer patients, and even
right.
even in spite of extensive treatment, is quite not as good as we would hope. It gives us very little time once it's there. And I've always wondered whether the specific the difference in the way the genetics of the oral mucosa and also the connective tissue, which are very differently derived compared to the rest of the body, that might be a part that makes it different in terms of why it takes so long to actually begin, and then why it then goes into overdrive. It's
Right.
always been interesting, yeah. So okay, we have, I think, no more comments or questions, and thank you everybody for being with us. So I shall just share now your certificate. Thank you so much. It was great. One second. I shall have to bring you back for some reason. Mhm. Right. Yes, now you're back.
Yeah. Thank you so
Okay.
much. Thank you so much, Mandana, for calling me. I really wanted to reach out to everyone regarding, this particular protein, and I sincerely wish that someone takes this up. Maybe we may come up to some inconclusive thing about PERP, but in the bargain we may just accidentally find something different, which would be extremely critical for its the initiation of this particular type of carcinomas. And we are oral pathologists, so I feel we all should really stick on to our core subject, because due to various reasons we have been diverting ourselves and branching out. It's not bad, it's very good. Everybody should be, but then we are oral pathologists. Let's continue to do something for the betterment of mankind. Let's hope that this disease never happens. If it happens, it's caught early. If caught early, it is treated, and the patient is hale and hearty and leading a normal life. So that is to wish that this happens.
Yes,
Thank you so much, Vandana.
definitely. You are most welcome. We have, I think, one comment from, yes, Dr. Nasser. Thank you. And I agree with you. Very fertile areas in autoimmune research, pemphigus and pemphigoid. Yes.
Yeah,
And okay. So, thank you everybody for being with us. And I am going to end this week's event by running the information on the upcoming conference again. The registrations are open, and I have just put the link on YouTube on the chat. If you're on Facebook, it will be shortly put up on our page, so you will find it there too. And it will literally be there everywhere that we are. That is where on LinkedIn, on Twitter, on Facebook, and on Instagram, and of course on Oral Pathology 360's newsletter. So you will be able to register. And also the links, I promise you, the links for submitting abstracts will be also open in the next 2 days. So we're just working on that. That also will go up in the next 2 days. So you can submit your abstracts for cases. And this time we are also taking posters, and everybody is eligible to present. So it's not like last time we had only early career oral pathologists. So this time it is anybody, and also we it is including oral our colleagues in oral medicine. So I hope there will be a lot of interaction from everybody. I will just run that, and with that we shall say bye. And I definitely hope to see you all again next week. Bye. Yes. Bye, everyone. See you next week. Do register and have fun. See you back soon. Bye.